The highly contagious COVID-19 variant that first emerged in India is spreading at a rapid rate in the U.S. and now makes up 7% of all new cases. Just last week, the World Health Organization said that variant is one of global concern, requiring heightened tracking and analysis. Joining us now to talk about that and more is Dr. Hlatshwayo Davis, Infectious Disease Physician at the John Cochran VA Medical Center and St. Louis City Board of Health. Dr. Davis, thanks so much for being with us. Lots to get here with you today, but I want to start with that variant that is now starting to pop up in new cases here in the U.S. Are the vaccines on the market right now proving to be effective against this variant?
So far, we're seeing that these vaccines are highly effective. We're going to continue to see strains. We've seen them since the beginning. They weren't as concerning until we started to see the UK and the South African strain in December and January of this year. And this is going to continue to happen. So while we cannot say with a degree of specificity as to whether the vaccines are effective against the India strain or any new strain that pops up in the early stages, what we know is overall our cases and our deaths are going down across the country. So these vaccines work. And science will continue to do what science does, which is to make adjustments where necessary. And if there is an uptick in cases, especially severe cases, hospitalizations and death, then that will be looked at more prudently.
What about families who have been vaccinated except for the young ones? I'm talking about those under 12 who have not yet been okayed to receive the vaccine. As those people get together with others, should they still be requiring that those young children be masked up? Should they maybe not be seeing certain groups because the young person is vulnerable? Because when you look at the numbers, doctor, young people are not getting infected nearly as much, and when they do, it's not nearly as serious.
Absolutely. And that's what's reassuring. I tell people all the time that if COVID had impacted kids the way that it impacted adults, I don't know that I could have done this with the degree of sanity that I've been able to do this over the last year. And I'll tell you what, I'm a mom first. You know, I have a 4-year-old and I have a 1-year-old baby, and they can't get the vaccine. So this is a topic that's very near and dear to my heart. And the way that I deal with it, the way me and my husband sit down and deal with this is our kids cannot get a vaccine. So we treat them like any other population that cannot be vaccinated. Where kids can mask, they should be masking, especially indoors. They should still be social distancing wherever possible and hand washing past that. We will get there. You know, we're one of the countries, the foremost country around the world that has the highest degree of privilege and capacity to vaccinate folks. We're doing a phenomenal job, and we're hoping to get all kids vaccinated by December, if not early into next year. But until then, that would be my approach as a mom first.
And what do you think about schools reopening in the fall if we don't have a vaccine approved yet for kids under 12? Would you feel comfortable? I mean, you have young ones, really young ones, but would you feel comfortable sending your child to school full-time in person without them being able to get vaccinated?
Listen, not all situations are created equal. It depends on a number of factors. The first being the case positivity rate. To what degree are we seeing COVID cases in the region that is being discussed, in the city and the county that is being discussed? And then it's about access. You know, I'm fortunate to be able to send my kids to schools that have the capacity to enforce the appropriate COVID guidelines, screening and safety measures. That's not the case for all schools, unfortunately. And until we can ensure equity across the board, then that answer is not a blanket answer. But if you live in a city, state, or region where the case positivity region is low, rate, I beg your pardon, is low, and by that I mean below 5%, where those schools have the capacity to protect both kids and teachers, right? They need to be able to mask. Have teachers had the opportunity to vaccinate? And are they able to ensure that the strictest protocols are being enforced. Adequate ventilation, the ability to sterilize in between letters and to provide adequate distancing indoors. If that's possible, I have no problem with that. On the Board of Health for the city of St. Louis, we saw incredible data about the ability to do so across schools of multiple levels, elementary, middle, high school, and even our colleges. And we saw that where that could be enforced, there was no great signal towards high transmission.
I also wanted to know, on the ground there, the work that you are doing, are you seeing that the tolerance for vaccinations is going up? Has it leveled off? I don't think we've seen what many feared was going to be a steep drop off in people getting vaccinated after the CDC lifted so many of those COVID mandates. What are you seeing?
That's an excellent question. And I'll tell you that as a public health expert, we saw what we expected, which was in the beginning, we would see folks that were excited. The folks that believed in this vaccine sort of ran to it. And then there was a leveling off of sorts because we hit that in the middle population, right? People who are like, wait, I just want to see, let me see how everybody else does when they go first, or just the very resistant group. And so our approach now is very different and has to be very considerate of those populations. National surveys have shown that while vaccine confidence was a concern in communities of color, where they were provided trusted resources from trusted messengers, vaccine confidence has gone up significantly. However, we are still seeing resistance, and unfortunately, in our rural population and in folks who identify as GOP men, Republican men, or uneducated college uneducated white men as well. And so we have to be thoughtful about why that may be and gear messaging towards them with inclusive and messaging that helps them to understand why this is important for them and the communities they love. Because at the end of the day, we all have that in common. We want to do what's best for ourselves and our families, and we care about our communities.
For sure. All right, Dr. Davis, before we let you go, I'd love to get your thoughts on these thousands of emails that have been released. They were private emails from Dr. Fauci with others, with the media, with scientists in China, especially during the early days of this pandemic. What do they tell you about the U.S.'s response to the situation as it was unfolding in real time?
Well, first, I want to say, Dr. Fauci continues to show himself to be an incredible leader. If I had thousands of my emails publicized for the world to see, I'm not sure that they would be filled with as much integrity, honesty, and truth as he displayed. Those emails showed the markings of what many of us in the healthcare sector experienced, especially in those early days. We were exhausted. We were sometimes frustrated, but at the end of the day, we wanted to do what we feel like we've been put on this earth to do, as far as, take care of people and teach people and be able to provide, take these sometimes complex to understand issues and make them accessible. And that's what he reflected. I mean, I've heard him say that there are no days off for him, that he starts as early as 7 a.m. and goes into the late evenings. One of his emails talks about how this went back to residency and days, which any doctor, and myself included, will tell you are the busiest, where you're on call and you're doing a lot of work to be able to take care of people. But he didn't ask for anybody's sympathy. This is the job. This is what he signed up to do. And he was leading as he should. And I feel like those emails do reflect that.
All right, Dr. Hlatshwayo Davis, thanks so much for being with us today. We appreciate it.